Excellent. Yeah, so we're trying to record it all today. So
Yep, we are
anyone
now
who
recording.
misses, fantastic. So good afternoon, everyone. For those of you who don't know me, I'm David Bell. I'm the preparedness coordinator at the health department. So I joined on just as all this fun stuff with COVID-19 was really taking off, and have been loving every minute of it. So anyway, happy to be here and looking forward to working with all of you under more normal circumstances. But for right now, just trying to kind of get through our current stuff. Obviously, as we're reopening, we've had a lot of attention to temperature logging and health screening. So that's kind of the main focus of our quick check-in today, is going over that and really kind of looking at any of your questions. What I want to do is just take 5 to 10 minutes and just kind of run over the sign-in sheets as well as kind of the cards that everyone received with the different symptoms for COVID-19. And then hopefully kind of turn over to you to ask a few questions, not just for the benefit of people on right now, but for the benefit of anyone who might kind of look back at this later on. So basically, the way I see it, there's 3 things that are really worth checking in about that there could be some potential confusion on. We're asking all of you as department leads, that is assessing what is a baseline symptom. Because the questions ask, do you have any COVID symptoms above your normal baseline? And you might get some questions from employees about that, or be put in a situation where you have to give your input to assess what could be considered baseline. There's situations where you as supervisors can allow for temperature retakes. So that's the next issue I want to quickly address, when it's appropriate to do the retake of temperature. And finally, what to do when someone calls you saying, I just answered yes to a symptom, what happens next? Or to one of the other questions on that particular card. So really quick bottom line, the point that I want to make more than anything else is that we're not putting anyone or asking anyone to be in a position of giving any medical guidance. What we're asking for is your judgment, your assessment of intent related to these things. So instead of looking for a medical opinion, we're asking you to judge the situation and intent going into it. So as it's related to the baseline symptoms, obviously this is putting each employee to assess their own baseline and make their own judgment on that, and use a supervisor to kind of make any assessment if they're uncertain about it. And if there is a degree of uncertainty, then to err on the side of caution, and we'll obviously count that as a yes. When you do get a yes, what happens is that each person is referred to their medical provider, their primary care physician or PCP, and if they don't have a PCP, to urgent care. So that takes the pressure off of you for saying, oh, you must go get a COVID-19 test or swab. But if someone answers yes to any symptom, it's our responsibility at the department level to say, okay, you need to get some medical advice on this. So again, none of you were asked for that medical advice, but for just the supervisory role that you already have. At the medical level, the PCP or urgent care, they will look at the situation, and if they deem correct, then they go ahead and do the swab and everything else. If medical care does advise a swab, we're not having people come back to work until we get the results of that swab, until they get a negative swab. So that's for that piece. Obviously, there's some nuances that I think are worth addressing and going to a little bit more, but to quickly touch base on the temperature monitoring, we have lots of means available to measure our temperatures, whether it's a contact list thermometer, a traditional thermometer, or so on. A lot of us at the health department are taking our temperatures at home even before we come into work, just to take that time out of the day and avoid any backlog. So all of those are acceptable means, and basically the check-in sheet when we get to work is just certifying that we did take a temperature before that work period, that the temperature was below 100.4, and that we answered no to the 3 screening questions of symptoms, not currently not testing positive, and not being in close contact with the known positive. On occasions, if it's a very hot day, if someone's coming from hot facilities, it's very plausible for there to be a false reading. So when we had our stretch of 95-degree weather We had a whole bunch of people that were testing if they were coming from an unair conditioned car or maybe walking from outside. So if there's some reason to suspect the validity of the reading, it's perfectly fine to ask the employee to sit down, wait 15 minutes, and retake it if they had an elevator temperature in the beginning. So if it was meeting that 100.4. This is to make sure that we're actually assessing for fever as opposed to kind of anything else. And again, rather than this being a medical assessment on your part, it's a judgment call and related to intent. Is there legitimate reason to suspect that a reading being accurate? So if there's a doubt of it being accurate, then we do want to retest it. And again, if the fever, if it's actually fever and not just an elevated reading for some other purpose, then the protocol is for the employee to go home and seek medical attention to see if they're recommended for the COVID-19 test. Theoretically, anyone answering yes to either the part B or C. Jay, was that you? Or, I'll keep going and then we'll turn it over to anyone else, a tiny bit of feedback. But anyone answering yes to the B or C about getting a positive result or being in close contact, all those people should be under orders from the health department anyway. So theoretically, they should be under our orders if they're a Genesee resident, and they shouldn't be showing up to work. Only essential personnel can work under quarantine. That's when you're being observed for symptoms because of a close contact. Isolation is for people who are positive. So we're not expecting too many people to come into work and answer yes to those part B and part C of the questions of having had COVID-19 the past 14 days or close contact without already kind of knowing it. But it is possible and certainly something we want to be on the lookout for. I think I've kind of rambled on enough as a quick introduction to what I see as kind of the main issues and kind of summary of what's going on, but certainly more interested in how it looks from your perspective. There's been a few of us that kind of work to put this together. It's not perfect, it's not ideal. It's juggling kind of state guidance, which has been vague at times with, policies we know we need to implement, but we've certainly done the best we can. But wondering how it looks from your side and what questions you have.
Barbara, I can't hear you. I still can't. There is a chat box if you want to type in the chat box. In the meantime, while we're waiting for Barb, one thing I'll point out is that the card, we sent a card out to all the employees with some of the symptoms. I actually put it on the back of my ID here so that it's something I can remember. There is some additional questions, some additional symptoms that came out after the fact. We did our best to try to stick to what CDC guidelines were at the time of the printing, and then the CDC guidelines actually changed, and a few more were added. Some of the nurses over at the health department pointed out the additions that really need to be on there, and we agree. So Tammy sent out an updated attestation log that included the new symptoms. So that was sent out to all the department heads on Friday, and we can certainly resend it again to everyone just to make sure, so that it's a good baseline what's on the card that people should be asking. But when they actually go into the or wherever they're checking off on this or whatever the process is, there are additional, I would think about 4 more symptoms that have been added. And some of these newer ones, actually, my understanding from the health department is that we've had some, this is really localized in a sense that they can attest to a decent percentage of of Genesee County infected COVID-19 patients that were experiencing some of these additional symptoms. So these are good symptoms that were added, and I hope that everyone gets a chance to look at that and not just go off the card, but take into consideration the new ones.
And that's definitely true. So we are looking at CDC, but CDC is looking right back at all of us kind of on the ground, so to speak. This is kind of a fluid situation with symptoms, and it has been updated. Some of the important ones that weren't, reported early on, of course, are like the fatigue, the headaches, the loss of taste and smell, and potential for diarrhea or nausea and so on. For that reason, we kind of did push to expand the list, and we still have that footnote in there saying that it's useful to check the CDC and other sources kind of periodically to see those updates and kind of any more nuance to that. So anyway, we're grateful that we kind of expanded that list a little bit because we did think that some of those symptoms were important to add. Just on that topic and kind of looking at one of the questions, the fever itself is just the most prominent symptom. That is a symptom. So that's part of the list. So by asking for the temperature check and no to the screening questions, that temperature is just one of the symptoms. And if an employee has any symptom at all, then we're referring them to the medical provider. So it's not like a fever and an additional symptom, because the fever itself is just the most visible kind of go-to of the symptoms that we're doing as an external measure. The other ones we're taking as a self-assessment where, have you felt feverish? So even if someone measures zero fever, but they've had chills and felt feverish, that's technically a symptom that we'd want to pay attention to. And if it's above baseline, then we're recommending people to healthcare providers.
And to follow Barb on that one, the key is the baseline. I think that was a good piece to put in there for some clarity, because I said this before that I wake up with muscle ache every morning. If it's just straight muscle ache, then I would have symptoms. I'd hit a couple of these every day, but it's above your normal baseline. So if you're already sore every morning, you got to be above your normal soreness for it to be a symptom.
And that part is a little bit tricky because baseline does function a few different ways. So we have our normal kind of baseline on a day-to-day basis. And especially right now, there's a seasonal baseline where there's tons of allergens coming out. That's probably the trickiest thing we're going to have to deal with right now. And again, we are on the side of caution on that supervisory level because people kind of know their own allergies, their own baseline better than we do. So if they have a reason to be suspicious, then we want to basically support that and say, yes, we support you getting at least talking with your medical provider to see if you should get tested. So Barbara, I don't know if that helps or if there's other similar questions.
Yes, this is meant to be a relatively quick, straightforward training. This is not an end-all, be-all. If you have more, David Bell, Tammy Feringer, they help put a lot of this together. Anyone else in the health department, please reach out. This is just to give some comfort to supervisors that could get the phone call, and they want to be able to. We want to make sure that supervisors feel comfortable enough to, yes, advise to go to their health professional, and that's probably going to happen 99% of the time. If you're calling with a symptom, you probably, and you know your body better, just like you said, David, that we're probably going to advise, but we wanted to have this step put in there and make sure that they're checking this to their baseline. I think that's one of the biggest things as a supervisor you could do, is to make sure you reassure them or have them make sure they're referring to their own baseline, because it's easy if they're just looking at their own card and they say, geez, I have a cough, but it's seasonal, then maybe it is nothing out of the ordinary. So I think Barb's got another question in here.
Yeah, the other important part about baseline is that that's when you're actually feeling sick, and we don't want folks working while sick, particularly now, given the additional risks. So if the answer yes and go home, if they're recommended for the test, we're waiting for that test result and waiting for the negative for them to be able to return to work. If it's a positive, obviously they're staying out of work and they're under isolation, which means they are out of work for a minimum of 10 days. And the last 3 days have to be without any fever and significant improvement in symptoms. And that part you don't have to worry about because the health department will release them from isolation, then they can return to work. But it's a minimum of 10 days out of work. If they go home, they speak to a medical provider and they say, you know what? We actually think that's kind of baseline allergy, or we think that's something else. If for some reason they don't do the test, then the employee can, of course, come back to work when they're not sick and that symptom is subsided. Because either way, we don't want them returning as sick. but the only holdup is if medical provision recommends the COVID test, and then we want to wait for that.
And David, once those test results come in, you get immediate notification from the lab through the state of New York that there is a positive person here in the county, correct?
Correct, and it's
In
pretty
general,
quick
of
now.
all 59,000 of us.
Exactly. So we're usually getting about next day return on that.
Right, that's the other thing.
So regardless of the result, we should know within 24 hours, 48 kind of max at this point, but we almost always get it 24 hours and follow up immediately with any positive.
And it's safe to say also that this is going on throughout the New York State employment sector, public and private, with regard to, because we are such a high rate as far as COVID-19 is concerned, and also with regard to the nature of how the State Health Department and the CDC and you guys, the public health directors, have coordinated our response and our ability to, as they say, flatten the curve.
And it's been working. I mean, all the social distancing we've been doing obviously hasn't been easy, but it has made a tremendous impact. And so all of us are just trying to continue supporting that right now.
Well, just remember, if we were in Tompkins County, we just hug trees, not people. So, you know.
Love all around, I guess.
Are there any other questions as a supervisor that you might have, or any uncomfortable level here, as anything that David could help with? Again, if this is being recorded, it can be referred to later on, passed along to additional staff and the other supervisors that need to see this. If we find out there's still a decent number that need this training, we can always do another live training as well. But at the end of the day, we want to make sure that people feel comfortable if they get a phone call of what they're supposed to say for somebody that might have a symptom. All right.
And I think the most important part about this, just to kind of end on, is that, you know, it's not really a training in a traditional sense, but really just it's an outreach, a show of outreach, kind of health department, other departments, but all of us together kind of as a collective group.
Yes.
So if we have questions, I think kind of reaching out and asking one another is really the important thing to do. It's my hope that all of you have my cell phone. I'll put it here or follow up in the email. I know Matt and Jay, you have it there. I'll send it out right now so everyone has it. And that's part of the program.
Great.
And please feel free to follow up if you have other questions. You can, call, text, or email anytime. This is kind of an ongoing process, ongoing dialogue, and, we're here to help one another.
Absolutely.
Thank you, David. Thank you, everyone, for your
Thanks.
participation and your understanding of these crazy times.
Everybody be well and be safe, please.
Oh, hold on. Before you sign off, let me make sure the cell goes to the whole group, and then we'll have it part of it. So there you go.
Right at the bottom of the screen.
All right. Be well, everyone. Thank you.
You too, David.
Everyone.
Thanks to everybody.
Thank you.